I did 1,005 push-ups. And let me tell you what, the last 50 were tough. And now I don't do them all in a row. You got to do those in sets. You know what the record is for number of push-ups, military push-ups, done in a row? Guess what the number is. Now, this is not sets, but somebody gets down and does push-ups in a row. Guess what the number is?
Trying to think of probably about, maybe 500?
There was a Japanese guy in 1980 who did 10,870 in a row. Now, how do you do that?
You start by doing one.
One at a time.
And one at a time. One at a time, Shriners. So you hit, so even though you're on vacation, you and your lovely bride.
Oh, yeah, but that's the deal. Jenny says, "Aren't we going to go eat?" I got to do push-ups. Don't you think you're carrying this a little bit too far? She said, well, when you get into something, you always take it serious.
Well, here's the deal. I mean, you're walking a walk, because if you have a really obese doctor talking to you about your health,
that's true.
It's right, and the guy's like huge, or the gal's huge. You're like, really? You're talking to me about health? But you.
So I'm down to. I've been down to 178 pounds from 192 since the first of the year. So, and the whole key thing is, ladies and gentlemen, two things you have to do. You have to have a good to lose weight. You got to do two things. You got to make sure you have a good metabolism, good metabolic rate. In other words, you got energy. If you don't have energy in your body, that means your metabolism is low. If your body temperature is low, it should be 98.6 using a normal oral thermometer like we used to have in the old days. Now they got tapes and all, so it gives you all screwy readings. It should be 98.6.
Right.
Most people we see at our center, women are 97.2 is the average. Men are 97.6. So they're 1 to 1.5 degree below normal. That is a sign that your body's not producing enough energy, because the excess energy that your body makes from the food you eat in the cells is given off as heat. That's what gives your body a temperature. And 98.6 is the temperature your body. All the enzymes in your body, in the cells, all the chemical reactions run best at 98.6. So if check your temperature. If your temperature is low and you look in a mirror and you're overweight and you got no energy, there's a high probability you have low thyroid function within your cells. Doesn't necessarily mean you're not producing enough thyroid, but what it can mean is that you're not getting enough thyroid in your cells. And that can happen as we mature. As women mature, their hormone levels become imbalanced and they decline. And the key hormone women have are estrogen and progesterone. They balance one another. And as women age, the hormone progesterone is the hormone of the last half of the month. It's also the hormone of pregnancy. It promotes gestation. So in a 28-day cycle, a woman will make estrogen in increasing amounts all month. But in the middle of the cycle, she'll make progesterone when she ovulates. And as women mature, they don't ovulate every month, and then they produce lower levels of progesterone, and they get dysfunctional uterine bleeding, heavy periods. They get mood swings. They get fibrocystic breast disease. They get headaches. They get weight gain. They don't feel well, and that's a sign of low levels of progesterone and estrogen dominance. That adversely affects the cell's ability to uptake thyroid hormone, which is the hormone that governs your body's metabolism. So they'll become functionally hypothyroid. Doesn't always show up on a blood test. The blood tests are so broad that 95% of the people always fall within the range on a blood test. So I've had people tell me, I literally have walked up to people, Sam, with my card. I feel so sorry for them. I go like, I don't know if anybody's told you, you are classically hypothyroid, and you need to see somebody about that. Well, I talked to my doctor. They said my blood levels were normal. Well, they're going to be normal in 95% of the people. That's just many doctors, and most doctors govern people by their blood tests and treat them by their blood. In the old days, we treated people by their clinical symptoms in their history. So if somebody's floridly hypothyroid, has got no energy, can't think clearly, they got mood swings, they feel depressed, they have stomach function's not good, they got constipation, they get recurrent and chronic infections, their hair's falling out, particularly in women, they're puffy, they're pasty, they're pale, they got no romantic moods and inclinations, they got joint muscle aches and pains. These people have classical symptoms of hypothyroid, and what we do is we give a clinical trial of thyroid preparation. If they have thyroid symptoms, and we use natural thyroid. So I would highly recommend any of the guests or any of the listeners, if you have that. I've got a book, and it's called Hypothyroidism, Health and Happiness. Hypothyroidism, Health and Happiness. If you'd like a copy of that book, if you will call today, I'm going to tell my office, the people in the new guest department, to give you a copy of that book. They'll send it to you. Call 281-698-8698, 281-698-8698, and this discusses thyroid disorders.
Love it.
Hypothyroidism, Health, and Happiness, and I'd love to give that as a free gift to help people so they can get in good health and get their weight down to a good weight. Remember, thin people live longer than heavy people. So I want you to be thin. I want you to be a lean, mean machine.
Amen to that. It's Hotze Health and Wellness, Hotze, Hotze Health and Wellness Center. Online, getyourlifeback.com. It's brilliant. There's a great video there and all kinds of information. And he's a great man, and he's like the only doc probably in America who can bang out 1,000 push-ups in a day.
You know, I asked Janie, I said, sweetheart, have you done 1,000 push-ups in your life? And she said, no.
1,000 a day. I can't wait for the next update.
Oh, sir, that may be up. That's upper limits.
Well,
okay, God bless you. Y'all have a great week.
You too,
Make it a great week. Make it a terrific week.
Roger that, boss. Our great Steve Hotze. Thank you, sir.
Okay,
My buddy. Go to getyourlifeback.com from Hotze Health and Wellness.